Welcome to another episode of FSD Doctor Talks. Rejuvenation versus beautification. What actually works? Today I want to talk about something every single person thinks about: aging. And more importantly, the difference between rejuvenation and beautification. Beautification is what you see online: trends, filters, angles, quick fixes that change the appearance. Rejuvenation is biology. It's protecting your collagen, your elastin, your bone structure, your skin barrier. It's slowing the rate at which the face actually ages. There are two different goals, two different outcomes. Let's simplify it. Let's make it practical. And let's make sure we're not giving false claim, especially around some of the controversial products. The face doesn't just wrinkle, it loses structure. Aging isn't just lines, it's thinning. Your collagen declines, your elastin weakens, your bone slowly remodels, your fat pads shrink in some areas and pool in some other areas. Skin loses its water-binding molecules. This starts far earlier than people think. Collagen actually peaks at around age 18. The downhill slope starts after that. So, prevention isn't just helpful, it's actually the entire game. Now, the foundations for real rejuvenation. Number one, sun protection. That's the single most effective intervention that you can do. If you only do one thing for your skin for the rest of your life, make it sunscreen. Get some mineral sunscreen, zinc or titanium, SPF 30 to 50 every morning. It protects collagen, it slows wrinkles, it prevents pigmentation, and dramatically reduces the visible signs of aging. Chemical sunscreens blend easier but break down faster in strong sun and also can irritate some skin types. Mineral sunscreen is your reliable daily shield. Now, the second one is retinoids. Let's be accurate about the evidence. There is some misinformation, so let's talk about it. Retinoids are often called the gold standard in anti-aging, and that's true, but only for the topical ones. And here's the clear, honest science. Topical retinoids like tretinoin or retinol have strong evidence for anti-aging. They improve the skin because they boost the collagen, they smooth the fine lines, and even out pigmentation. They increase skin turnover and repair the early skin damage. This is supported by decades of dermatology research and universal consensus among aesthetic experts. Now, the important clarification: oral retinoids like isotretinoin are not anti-aging treatments. Oral isotretinoin is for severe acne and for shrinking sebaceous glands and for oil control. It does not stimulate collagen, and it is not used in aesthetic medicine for rejuvenation. So the message is simple and accurate. Topical retinoids help aging skin. Oral retinoids treat acne. They are not interchangeable. So how do you use them? Start slow, 2 to 3 nights a week, then build up as your skin tolerates it. A small pea-size amount, include under the eyes and in the neck, and use sunscreen during the day as usual. Retinoids are not overnight magic. They work over months and years, and they do make a real difference. Now, the third concept is vitamin C helps with brightening and collagen support. Vitamin C helps brighten the skin and support the pathways that build collagen. It also keeps pigmentation even. Use it in the morning before sunscreen. Choose a stable product. When vitamin C oxidizes and turns dark orange, it's basically inactive. The next concept is cleansing your skin. Don't damage the barrier. Avoid harsh, foaming cleansers. Use a gentle cleanser that cleans without stripping. Your skin barrier is precious. Please protect it. Next concept is moisturizing. Hydration softens visible age. Hydration instantly makes skin look healthier. A simple moisturizer can soften fine lines because hydrated skin looks plumper and more alive. Younger or oily skin may need less. Mature or dry skin may need more. Now, the real deep aesthetic medicine, that is products, they can help, but lifestyle writes your story on your face. The biggest accelerators of aging are poor sleep, chronic stress, high sugar diets, low protein, and no strength training. Protein supports collagen. Strength training preserves bone and muscle. Sleep repairs the skin, and stress breaks it down. A healthy lifestyle always shows on the face. Now, there is a role for procedures when prevention needs support. When the prevention has done what it can, some procedures can help. They come in two categories. Number one is rejuvenation, restoring what's lost, doing microneedling, light treatments with lasers, platelet-rich plasma in selective cases, and very conservative volume restoration. These aim to rebuild, restore, and to maintain your natural identity. Now, I'll just talk to you about beautification, which is the other flip side of procedures. They're changing features like trend-driven facial shapes, overfilled cheeks, and excessive lip augmentation. These can distort natural anatomy and they really don't age very well. If you are choosing a procedure, aim for restoration, not reinvention. The simple routine that works. If you want the most practical routine, morning, cleanser, vitamin C, mineral sunscreen. Night, cleanser, topical retinoid, moisturizer if needed. That's it. 3 or 4 steps. Consistent, evidence-aligned, long-term results. In summary, aging is natural. Accelerated aging, however, is optional. You don't need a bathroom full of products. You don't need filters. You don't need trends. You need protection. You need retinoids, the right kind, a good antioxidant. You need a gentle cleanser. You need healthy skin habits and a healthy lifestyle. And remember, rejuvenation is slow, steady, and rooted in biology. Beautification is fast, flashy, and often temporary. Choose the long game because real beauty is consistency. Thank you for watching this episode of FSD Doctor Talks. Please include any questions or comments about anything that I've spoken about. And if you have ideas for new episodes, please pass them on. Thanks for your support so far.